Most of you are aware, I'm Fawzia Kirai Khan, Head of Learning and Development at TPL. We have with us the Honorable Dr. Raziuddin Bayabani from, he's an Associate Professor and Program Director, Urology Residency Program at the AKU. Dr. Saab has a very illustrious career. Since after his residency, he has been heading the urology department at AKU, and his main interests lie within endocrinology, endourology, urinary stone disease, prostatic diseases. Dr. Saab has also published over 50 publications, 4 book chapters, and has co-edited 2 books. Thank you very much for being with us today, Dr. Raziuddin Bayabani. As I understand it, your main topic of discussion today will be lower urinary tract symptoms in men, benign prostatic hyperplasia, and carcinoma of the prostate. In our earlier discussion with Dr. Saab, at least I was very interested and heran, to be actually use that word, to hear that benign prostate cancer is far more common than the actual ones that we know of. So Dr. Saab is going to tell us some ways to perhaps mitigate the risk, what precautions one should be taking, and how to deal with the symptoms. Shall I hand over the floor to you, Dr. Saab?
Yeah, thank you. Thank you.
So,
can you see my screen now?
Yes, we can.
Is slides okay? Thank you very much for inviting me to talk on this topic. I see more, well, equal number of ladies in the audience, but that's good. They want to be, they want to know about it. So what? So it's yeah. So here's my disclosure for this presentation. So what we're going to do in this session is that we're going to talk about lower urinary tract symptoms in men. A lot of females may find similar symptoms, but our focus today is men, and I guess in connection with the celebration of the men's symptoms and all that you guys are also doing. So we're going to talk about, we're going to define the lower urinary tract symptoms, what they are, and how when you consult them, what we do to find out the cause and how we investigate. Then we'll move on to the topic of management of benign prostatic hyperplasia, which is a very common condition and affects half of men above 65, although not all require treatment in terms of medical or surgical treatment. Then we'll also cover carcinoma of the prostate. It's not as common as BPH in our population, but nevertheless, it is becoming very common, especially in as our diet is becoming westernized, and you know, so is the disease becoming common. So lower urinary tract symptoms are symptoms. You know, when we say symptoms, we talk about what complaints the patients have. So these are called symptoms, and then what the doctor picks up while examination and history taking are called signs, right? So they are indicators of disease in the urinary tract. Sometimes the patients come up with them and they volunteer the symptoms, or the doctor takes the interview and picks up these symptoms. So they are usually qualitative, and in general do not lead to a definite diagnosis. So symptoms same hote hain, and it may be different diseases that produce the same symptoms, right? So what are the common causes of lower urinary tract symptoms in men? Urinary tract infection, it could be acute or chronic. Bladder outflow obstruction. One is benign prostatic hypertrophy. The prostate is a male gland, and it is at the bladder neck, and it is supposed to produce male secretions. But as men age above 50, this gland becomes enlarged, and it causes symptoms, and that needs to be checked and then treated. Then urethral stricture is something that happens in younger men. It's a disease in which the urethral passage becomes narrow. Then sometimes there are some nervous condition, neurological conditions that can cause lower urinary tract symptoms. Overactive bladder is one condition in which the bladder becomes sensitive and overreacts, and patients have to pass urine on and on off quite frequently. So other than cancerous conditions, bladder tumors and carcinoma of the prostate can also cause lower urinary tract symptoms. Then bladder stones, and in men sometimes there is inflammation and infection of the prostate that may happen. So if I'm using a lot of medical jargon and anyone wants to clarify and get some answers, they can ask in between or maybe ask at the end. So when we're talking about the lower urinary tract symptoms in men, we're talking about three main types: storage symptoms, voiding symptoms, and post-maturation symptoms. So as we know, urinary bladder is an organ which stores urine. When the kidney forms urine, and urine is, we know, the waste product of body's metabolism, and so urine is forming all the time, about 1 ml per kg per minute. So it's like 70 to 100 ml per minute urine is per hour of urine is formed. If somebody drinks a lot of water, more urine will be formed. So urinary bladder's function is to store the urine till a convenient time that we want to go and void and empty the bladder, right? So sometimes there is problem with the storage of urine, and the patient starts having symptoms, and we'll just talk about each of these. So storage symptoms include increased daytime frequency. The patient complains of having to void again and again, and cannot hold on and cannot carry on a meeting, have to go, and it's really bothersome for the patient, and because they have to go to the toilet again and again. And normal frequency is about 1.5 hours. So if somebody has to pass urine more frequently, we call this abnormal. Then nocturia is a very important symptom. Nocturia means having to get up at night to pass urine again and again. So normally, as one ages, it's normally to pass urine about one time at night. But if somebody has to go many times at night, that is not good for the health. That is, as well as it's inconvenient both for the husband as well as the wife, because they'll get disturbed. Some of the patients, when they come back, they can't sleep, and then their health is deteriorated. So it's very important to have a good 4 to 6 hours sleep at night. Then the other storage symptoms that starts happening is urgency. Urgency means that one has to rush to the toilet, or urge incontinence. Sometimes in doing so, if there's a delay, urine might leak out. So these are very bothersome and very bad symptoms for the patients. Then there are voiding symptoms, meaning that the symptoms occur while the patient is passing urine, and these include slow stream, the stream of urine becomes very slow, and there is hesitancy, means that it's difficult to start the urine, and then there is intermittency, the stream stops and starts again and again, and there may be straining, one has to strain a lot, and then there is dribbling at the end. So these are all symptoms of uh, while the patient is trying to pass urine, the patient experiences these. Then sometimes patients also complain of post-micturition symptoms, meaning that after one voids, one feels, and these are like feeling of incomplete emptying. Patient feels that the bladder is still full at the end. Then there is post-micturition dribbling. So these are all signs of some pathology in the lower urinary tract. There could be involuntary loss of urine after completion of the micturition. So these are part of the lower urinary tract symptoms. Just talking a bit more detail about this symptom of nocturia, other diseases can also cause other than the local urinary diseases. These may happen in when we call polyuria, means that increased amount of urine formation is there, and this can occur in diabetes. There are different sorts of diabetes, and then there may be in renal, when the kidney is not functioning well, or when there is congestive heart failure. This may happen, nocturia may happen. Then there may be some diseases that may lead to decreased size of the bladder, but they're like, so having to go on and off at night is a significant symptoms, and one must see their family physician or a physician to sort out what it is. It may also happen in heart failure and heart diseases. So that's important.
Dr. Saab, can I ask a question, please?
Sure.
In the previous slide, as I understand it, आप ये कह रहे हैं कि अगर washroom ज़्यादा जाना पड़ता है रात में, how do we define ज़्यादा? How many times is common?
So young people don't have to go at all if they don't drink a lot of water after evening. If they are drinking at the lot of water after dinner, then they might go. That is a separate thing. But I'm talking about when you have a normal water intake and you have to go more than once at night, we call it that this is significant, even on normal water intake, not on excess water intake, right? So 50 ke upar, it's normal to go once. 50 se pehle aksar log they will never, when they sleep, they have a sound sleep, and subah jab uthte hain, so then they have to. So if somebody has to go 3 to 4 times at night, this is significant.
Thank you for explaining that.
Right. So when we take history, we look at other nervous problems, neurological problems. If there is a lot of recurrent urinary infections, if somebody's had a surgery before, these are all significant things that we see. Then what we do when you go to a physician or a urologist, we ask for various diaries and charts. Sometimes they help to see whether the patient is drinking a lot of water, and what you just asked, that what is normal. Sometimes it's just that the patient is drinking a lot of water, and there is no pathology. So we
So he said once he likes something.
So if you can mute everyone, if somebody
I would
is not
request you all to
speaking.
please mute your microphones.
Yes, and if you want to ask a question, then you can unmute, right?
Thank
So, all right. So I'll just share an example of a chart. When we take a history, we ask patients about their fluid intake, and look at this here. In this diary, you see that at 9:30, this patient had 550 ml of fluid, and then went to pass urine at 9:50, and then similarly, uh, if you notice, the urination is frequent, but it's linked to a lot of drinking, right? So this condition. The patient presents with increased frequency, very distressed by it. But when you ask the history, you find that it's just that the patient has in the habit of, maybe some doctor has told the patient to drink a lot of water, and then the patients take that too seriously, and then they come with a condition. On the other hand, look at this diary. In this diary, you see the patient is passing frequently little amount of urine. By the way, the normal amount of urine is about 300 to 350 ml that one voids. If somebody is passing little bit, that is again abnormal, right? So in here you see 170, 90, 180. The amount of urine is not too much, but on the other hand, the intake is not too much. So this condition is called overactive bladder. This may happen. This is a condition in which the urinary bladder is very sensitive. It may happen in nervous people, um, type A personalities, very busy people, and it happens very often. And when you have, remember, when you have an exam or when you have some important interview, you tend to pass urine very often. So this condition is called overactive bladder. Then
Doctor,
what? Yes,
sorry to interrupt again.
no problem.
I just have a question. I mean, for a layman like myself, मुझे जैसे आपने ये numbers लिखे हैं 150 ml and 350 ml, I don't get it, right? So in terms of maybe glass intake and I
Yes.
suppose तरह से अगर आप समझा
So jab patients, if we are really not sure whether the patient is drinking a lot of water, is that the cause of the symptoms? Then one glass is about 200 ml, right? 200 to 250 ml. So roughly we tell the patients to, count like that. But the amount voided has to be measured in a jug. So there's a special jug for this, right? So we don't tell it to everybody, but when this is very significant, the patient says, "नहीं जी, मुझे तो बार-बार पेशाब आ रहा है, जरूर कोई मसला है," and it's very difficult to actually objectively know how much the patient is drinking. So in these situations, we need to do these diaries. So intake of one glass is about 200 ml. The larger ones are 250 ml. And the voiding bit, we need to instruct them to be in a jug, which helps to measure.
Right.
So then in men, there is this American Urological Association symptom score that we give to the patient and ask the patient to recall how often they passed, So this helps to all the questions. There are 7 questions, 5 answers for each of them. So there are 35 points and we score them. कि कितना severe इनके symptoms हैं, right? And that each question points out to one particular symptom, right? So that is just to make it objective. अगर कोई treatment देते हैं तो फिर treatment के बाद we repeat this, so we can objectively say कि हाँ जी इनके symptoms are better हो गए कि नहीं हो गए, right? Then there's a very important quality of life question in this, which is called, if you were to spend the rest of your life with these symptoms, how would you feel? तो उसमें ये होता है कि would they be delighted or would they be okay, कोई नहीं. So इससे पता चलता है कि how important is this symptom or the set of symptoms in their daily life, right? So once we know that there is a pathology, we examine the patient. और examination में क्या क्या चीजें important हैं? एक abdomen का examination करते हैं, एक pelvic examination हम करते हैं male में, जिसमें still rectal examination है, और एक neurological examination करते हैं. बाद में nervous system की disease की वजह से हो रहा होता है. So in the abdominal examination, if I'm going too fast, let me know. If I'm hard to follow, but I'll try to summarize it. If the slides are too busy, I might just skip them because some of the jargon may not be very relevant. So
That's perfectly right.
Right. So sometimes after passing urine, the bladder may still be full, and you can feel it, right? And if you apply pressure over the in the pelvic area, in the lower abdomen, the patient may feel pressure because of the full bladder. So that means there's some problem. The bladder is not emptying properly. Then we examine the external genitalia and look for any abnormalities. Sometimes there's narrowing. And then the very important examination is digital rectal examination. In the digital rectal examination, we try, it's a examination with the finger in the back passage, and the prostate is lying anterior in front of the rectum. So we can feel the prostate gland. So it's a gland we can actually feel how hard it is. Are there any nodules? So if there's a cancer, we can feel that, right? And we can make an estimate of is there enlargement of the prostate, which happens after 50 years of the age in many men, right? And then we can also do some neurological examination of the nervous systems to see if there is any cause which is related to the nervous system, which may be causing the patient's symptoms. In the investigations, we do a urine DR or culture. It's important to know that whenever you give a urine for any purpose, female as well as males, you should give a midstream specimen, because otherwise it's not relevant and the test goes waste. So what you do is, in the urine, one must drink water, fill the bladder, and then keep the container of the urine culture bottle handy, and then start urine, and then take the middle of the sample. That's very important. Whenever you give for any purpose, you give urine for DR or culture, you take the midstream. That's very important for both men and women. Then we do a serum creatinine, and we do a prostate specific antigen, which is a specific test to see if there is prostate cancer. So prostate specific antigen is a blood test. We don't do it in any patient because I will just talk about there are implications if there is false positive test, you may end up getting more investigation. So I'll just talk about it. Then we do an ultrasound. What does the ultrasound do? Ultrasound is to look at the condition of the kidneys and also to measure how much urine remains after passing urine, how much urine remains in the bladder. And then we also measure the size of the prostate, and ultrasound also helps to look, help to target the biopsy if it's necessary in prostate cancers.
Dr. Saab, I have a question.
Sure.
Dr. Saab, tell me, in some of your previous slide, you mentioned that if there is an unusual urination that is connected to even the abnormal nervous system, is this applicable on both males and females, or is this only particularly for males?
Both. It can happen both for males and females, but sometimes patients think that it may be the prostate that is the cause, but actually, like in diabetes, the nerves gets affected. Like in sometimes people with CVA, जिसे हम कहते हैं Falij, the stroke, patients with stroke have their nervous system affected. Their bladder becomes weak because bladder is also dictated by nerves brain and nerves, right? तो जिन लोगों की nerves weak हो जाती हैं, जैसे stroke में हो जाता है, तो the bladder cannot empty. So we need to, when we examine, we need to check whether is that the cause of the urinary problem or is there any obstruction because of the prostate gland.
Acha, if I continue the same question,
Yes.
if there is any symptom which is related to the nervous system, and if you do not address it for say a considerable time, what are the consequences?
If it's suppose the bladder is not emptying properly, and
No. My question is that if there is an abnormal urination which is not being attended, or any medical prescriptions are being taken, or a doctor is being consulted for a considerable time, what are the consequences? What further complications can we see in the patient?
Yeah, that's what I'm saying, that first we will see what is happening. If it's just that there's frequency and the bladder is emptying properly, then it's more of an inconvenience, and medication will, no harm will happen to the body. But if there is, because as a result of the nervous problem, neurological problem, the bladder is not emptying properly, then there will be back pressure in the kidneys, and one might have recurrent infections, or one might have renal failure, right? So देखना पड़ता है what is the, symptoms तो एक जैसी होंगी, बार frequent आ रहा होगा. Is it that the bladder is not emptying and there is overflow of urine that's happening in that patient because of the neurological condition? That once you diagnose, then you have to address. अगर bladder खाली नहीं हो रहा है, उसकी वजह से problems हो रही हैं, तो kidney failure हो सकता है, right? So that's very important.
Thank you.
Okay.
A quick question: how many
Yes.
glasses of water should a person have during the day?
Yeah, so that's a important, very pertinent question especially for patients who are prone to have stone disease. And normally, अगर आप जैसे आप air conditioned environment में बैठते हैं, ज़्यादातर indoors रहते हैं, तो about a liter and a half is enough, right? Which comes out to be about 6 glasses. मगर कोई बाहर रहता है, बाहर outdoor work करते हैं, तो उसमें तो 3 liters भी लेना पड़ता है. So the barometer is actually not the amount of fluid. It depends on what environment you are living in, but the barometer should be the color of urine. So if the urine color is very dark yellow, that means you're not taking adequately, right? Because it's the body's and the kidneys function to preserve water. So if you are working in a very hot environment and outdoor environment, even 3 liters may not be enough, right? And as you might have noticed when we go out the beach and all, अगर आप अंदर बैठे हुए हैं और कॉफी पीते रहते हैं सारा दिन, और that and your urine is just like water, बिल्कुल white है, that means you're taking too much water, right? So that is a better barometer that we tell the patients. कि light yellow होना चाहिए urine का color.
Right.
So that is a better sort of.
And so far,
Yeah.
Dr. what I understand is कि अगर आपके जो भी आपने urinary ailments बताए कि incontinence है, या फिर आपका bladder empty नहीं हो रहा, या बार-बार जाना पड़ रहा है, these all could lead to prostate cancer, whether benign or otherwise.
नहीं, कैंसर तो diagnosis करना पड़ेगा. Benign does not lead to cancer. Cancer is a separate entity, right? It's not a logical sequence. ऐसा नहीं है कि हाँ, तो ये symptoms तो similar होंगे. Prostate cancer में भी यही symptoms होंगे, BPH में भी यही symptoms होंगे, urinary infection में भी यही symptoms होंगे. मगर that is for the physician to investigate by these tests, right?
Right. तो basically अगर ये symptoms हो रहे हैं, तो जरूर जाना चाहिए डॉक्टर के पास.
हाँ, बिल्कुल investigate करना चाहिए उसकी वजह क्या है. And all these tests.
Sorry. मैं कहती हूँ कभी-कभार लोग कहते हैं कि डायरेटिक्स खा रहे हैं, आपकी जब ब्लड प्रेशर मेडिसिन में डायरेटिक होता है या कुछ होता है, that makes you go more often
जी जी जी
तो वो
if
सब
that is the
इग्नोर करके
reason,
अगर मजीद
हाँ, अगर that is the reason and we know that is the only reason, then that's fine. मगर ये है कि आप डाययूरेटिक ले रहे हैं और मतलब अगर आप सुबह डाययूरेटिक ले रहे हैं, नॉर्मली ना ये डाययूरेटिक्स वगैरह लोग रात को नहीं देते, दिन को
जी
देते हैं. सो दिन को देते हैं तो बाय आफ्टरनून दिस शुड सेटल डाउन. मगर ऑन टॉप ऑफ दैट अगर रात को भी हो रहा है, डायबिटिक्स जैसे हो गए, डायबिटिक लोगों को भी रात को उठना पड़ जाता है. सो देन दे हैव
जी
टू एडजस्ट देयर फ्लूइड. उनको मैनेज करना होता है. उनको हम एडवाइस करते हैं कि फ्लूइड्स कम जो है ना वो लें शाम के बाद, स्पेशली मगरिब के बाद. डोंट टेक अ लॉट ऑफ वाटर बिकॉज देन आप डाययूरेटिक भी ले रहे हैं, आपको डायबिटीज भी है. दीज आर आल्सो conditions that lead to increased urination. So the important thing is to sleep well at night, at least 4 hours. 4 to 6 hours is good. अगर रात को सोएंगे नहीं, uninterrupted sleep होगी, तो health अच्छी नहीं रहेगी. That's very important. Okay,
Thank you.
carrying on, we do this test called uroflowmetry. It is a objective test to tell us कि urine का flow कैसा है and is it abnormal, and we compare it with a normal, right? So we just talk about
डॉक्टर साहब,
the जी sir.
मेरा एक क्वेश्चन है. एक्चुअली माय फादर डाइड ऑफ प्रोस्टेट ट्यूमर. तो मुझे एक्चुअली इस बारे में ये मालूम करना है कि एट टाइम्स ऐसा होता है कि पेशेंट जो है वो एलोपैथिक मेडिसिन या एलोपैथिक ट्रीटमेंट को थोड़ा अवॉइड कर रहा होता है ड्यू टू सर्जरी और सर्जिकल इम्पैक्ट्स. थोड़ा सा फेयर होता है पेशेंट के सबकॉन्शियस में समहाउ के इट कुड बी हार्मफुल और मे इम्पैक्ट in other areas maybe. So he continued with Eastern medicine or homeopathic medicine. So do you think what is the proper treatment का जो एरिया है वो क्या होना चाहिए, क्योंकि ये थोड़ा सा होता है पेशेंट्स को, वो अवॉइड कर रहे होते हैं इस चीज को, और जब पता चलता है तो बहुत देर हो जाती है, फिर ऑप्शन होता नहीं है अल्टीमेटली पेशेंट के पास.
जी, the important thing is to diagnose it early, right? So I'll try to speed up and finish it by 11:45 so that we can. तो आपके क्वेश्चन का ब्रीफ आंसर ये है कि अगर अर्ली डायग्नोसिस हो तो उसकी ट्रीटमेंट बिल्कुल क्योर भी हो जाता है. बिकॉज प्रोस्टेट कैंसर यूजुअली इज अ स्लो ग्रोइंग कैंसर. मगर अगर वो डायग्नोसिस लेट स्टेज में हो तो देन there are less options, but there are palliative options rather than treatment options. So early detection में cure भी हो सकता है बिल्कुल, right? So we'll just talk about benign prostatic hypertrophy.
सॉरी टू कट यू डॉक्टर साहब. एक्चुअली पॉइंट इसमें जो मेरा सवाल का एक दूसरा पार्ट था वो ये कि वी कंसीडर के इट्स बेटर टू गो विद होम्योपैथिक और ईस्टर्न मेडिसिन रादर देन एलोपैथिक मेडिसिन. तो इस पार्ट पे सर थोड़ा सा अगर आप गाइड करें.
अच्छा देखें, होम्योपैथिक मेडिसिन की तो हमारी ट्रेनिंग नहीं होती, हमें नहीं मालूम उसमें क्या होता है. मगर हम जो है जो साइंटिफिक मेडिसिन है वो प्रैक्टिस करते हैं. उसमें बेसिकली डायग्नोसिस करते हैं और डायग्नोसिस करके बेस्ड ऑन द स्टेज ऑफ अ कैंसर, वी आर टॉकिंग अबाउट कैंसर राइट नाउ, आपका क्वेश्चन कैंसर. तो अगर वो स्टेज प्रोस्टेट कैंसर, सपोज प्रोस्टेट की बात हो रही है, वो प्रोस्टेट में कन्फाइन है, तो फिर उस प्रोस्टेट को या पूरा निकाल देते हैं या फिर उसको रेडिएशन से डिजीज को खत्म कर देते हैं, रेडियोथेरेपी जैसे कहते हैं. ठीक है. अगर वो बोन्स में या लिम्फ नोड्स में चला गया है तो उसके में अलग ट्रीटमेंट होती है, उसमें हार्मोन ट्रीटमेंट होती है, उसमें कीमोज होती हैं, राइट? प्रोस्टेट कैंसर में कीमो इतनी इफेक्टिव नहीं होती, हार्मोन ट्रीटमेंट. तो अगर आप, अब मैं ये नहीं कह सकता कि होम्योपैथिक में वो किस स्टेज से कौन सी दवाई देते हैं, क्योंकि मेरा दैट्स नॉट माय फील्ड एंड आई एम नॉट ट्रेन्ड इन इट. मगर ये कि होम्योपैथिक जो मेडिसिन होती है यूजुअली उसमें मैंने ये नहीं देखा कि वो पूरी तरह स्टेजिंग करें. स्टेजिंग का मतलब MRI करते हैं, देखते हैं कि किस लेवल कहाँ पे पहुंची हुई है डिजीज ना, तो ये इशू होता है सारा. वैसे अगर बहुत ओल्ड एज में अगर प्रोस्टेट कैंसर डायग्नोज होता है तो वो वैसे ही स्लो ग्रो करता है. फिर उसको इतना सिग्निफिकेंट नहीं होता, मगर अगर यंग एज में होता है तो सिग्निफिकेंट होता है। ठीक है सर, आगे
थैंक यू
चलें।
डॉक्टर।
श्योर। सो बेनाइन प्रोस्टेट हाइपरट्रॉफी जो है ना, ये नॉन मेलिग्नेंट इनलार्जमेंट होती है और ये काफी कॉमन होती है। और अगर हम देखें कि प्रोस्टेट होता क्या है, तो ये मेरा कर्सर नजर आ रहा है क्या आपको? नहीं ना? सो ये
नजर आ रहा
प्रोस्टेट,
है।
राइट। सो प्रोस्टेट ग्लैंड जो है, ये मेन में ब्लैडर के नीचे ये इस तरह से ग्लैंड होता है। ओल्ड एज इसका फंक्शन तो मेल सिक्रीशंस होता है, मगर जैसे आफ्टर 50 इट स्टार्ट्स ग्रोइंग एंड इट देन, देखें ये ब्लैडर की आउटलेट है, इसको ऑब्स्ट्रक्ट कर देता है। तो इसी में बिनाइन ग्रोथ जो है वो बहुत कॉमन है। अराउंड 50% ऑफ द मैन अबव 50 में बढ़ जाता है, मगर सब में मेडिकेशन या सर्जरी की जरूरत नहीं पड़ती। इसी ग्लैंड में लेस कॉमनली कैंसर भी हो सकता है, राइट, मगर सिम्टम्स सिमिलर होते हैं। इसलिए वो फिर एग्जामिनेशन से, जैसे मैंने आपको बोला डिजिटल रेक्टल एग्जामिनेशन या पीएसए का टेस्ट होता है, उसी से पता चल सकता है, राइट। ये भी हमने बात की कि 50 के ऊपर काफी 50 इयर्स ऑफ एज के बाद ये बढ़ना शुरू हो जाता है, मगर अगर हम ये देखें तो 90% of men above 81 will have it, right? So ये बहुत कॉमन कंडीशन है। और इसमें जो है आई विल जस्ट टॉक अबाउट, थोड़ा सा मैं स्पीड अप करता हूँ। क्यों बढ़ जाता है ये बेसिकली इसके बारे में एग्जैक्ट नहीं पता, मगर ये हार्मोनल इम्बैलेंस शुरू हो जाता है ओल्ड एज में। और वेस्टर्न लाइफस्टाइल में ये देखा गया है, वर्स्ट यूएसए में बहुत कॉमन है, हमारी जैसी डाइट में इतना कॉमन नहीं है, मगर जो होता है ना हाई मीट इनटेक और हाई कार्बोहाइड्रेट डाइट्स जो लेते हैं, वेस्टर्नाइज डाइट होती है, उसमें ज्यादा कॉमन है। और अमेरिकन में भी जो है ज्यादा, अफ्रो अमेरिकन में ज्यादा है, कोकेशियंस में कम है, मगर एशियंस में बहुत कम होता है ये प्रोस्टेट कैंसर भी। और ये ठीक है। सो इसमें ऑब्स्ट्रक्शन की वजह से जैसे मैंने कहा वही लोअर यूनिट ट्रैक्ट सिम्टम्स हो जाते हैं। और जो चीजें रिपीटेशन है विल नॉट। सो इसमें लाइफस्टाइल मॉडिफिकेशन, जैसे मैंने आपको बताया था कि फ्लूइड कम लेना, रात के टाइम पे कम लेना, ये एक ट्रीटमेंट होती है। कुछ लोग इसी से सेटल अप हो जाते हैं। फिर कुछ को मेडिकल थेरेपी की जरूरत पड़ती है, जैसे टैबलेट्स वगैरह देते हैं रात को सोते हुए। देर आर सम ऑल्टरनेटिव मेडिसिन, जैसे आपने कहा ना होम्योपैथिक, इसी तरह की नेचुरल मेडिकेशन भी अवेलेबल होती हैं। अबाउट इट। अच्छा, और अगर नहीं इन चीजों से फायदा होता तो फिर सर्जिकल ट्रीटमेंट करते हैं। तो सर्जिकल मेडिकल ट्रीटमेंट में दो तीन किस्म की ड्रग्स होती हैं। एक अल्फा ब्लॉकर होती हैं जो ब्लैडर नेक को रिलैक्स करती हैं, और एक 5 अल्फा रिडक्टेज इनहिबिटर होती है, वो जो है इसको श्रिंक करने के में काम आती हैं, या फिर कॉम्बिनेशन देते हैं। फिर एक एंटीकोलिनर्जिक मेडिकेशन होती हैं जो ब्लैडर को रिलैक्स करती हैं। ये कुछ मेडिकेशन है जो हम देते हैं इसमें। नेचुरल ड्रग्स जैसे साउ पाल्मेटो, एक साउथ अमेरिकन ये हर्बल मेडिकेशन होती है, ये भी बहुत से लोग इसके लिए इस्तेमाल करते हैं। इसके अलावा जिन लोगों में सिवियर सिम्टम्स होते हैं और मेडिकेशन से फायदा नहीं होता, उसमें सर्जिकल ट्रीटमेंट करते हैं। और सर्जिकल ट्रीटमेंट में क्या होता है कि इसको प्रोस्टेट को एंडोस्कोप से एक यहाँ से एक चैनल बना के इस प्रोस्टेट ग्लैंड को निकाल लेते हैं। ओपन सर्जरी अब करने की जरूरत नहीं होती। उसके अलावा दूसरी ट्रीटमेंट्स होती हैं, जैसे स्टेंट्स हैं और माइक्रोवेव थेरेपीज हैं। ये इतनी कॉमन नहीं है। जिससे कॉमन है वो ट्रांस यूरेथ्रल रिसेक्शन ऑफ प्रोस्टेट है, जिसे TURP कहते हैं, राइट। सो अब थोड़ा सा मैं प्रोस्टेट कैंसर पे भी बात करूं। सिम्टम्स आर ऑलमोस्ट द सेम, but if you see, it's very common in USA and in Pakistan. इतनी studies नहीं है, epidemiological studies पाकिस्तान में, but we have about 5 cases per 100,000, and this is less in Asian countries And the main thing is the westernized diet that is the causative agent. Very important is talking about how to diagnose this test about prostate specific antigen. This helps us to diagnose this condition. एक तो रेक्टल एग्जामिनेशन जो हमने पहले बात की, उसमें हमें कैंसर में हार्ड नोड्यूल्स नजर आ जाते हैं, और उसके अलावा पीएसए जो है ये एक टेस्ट होता है जो हम करते हैं. Problem with PSA is that it's not exactly very specific, although we call it prostate specific antigen, but it may be increased in benign diseases, in infections. You know, if somebody has had urinary infection या severe constipation में भी, तो ये मसला होता है. तो पहले या किसी को कैथेटर लगा है, बैग लग जाता है ना, कभी पेशाब रुकता है, तो उसमें भी पड़ सकता है. बट किसको करना चाहिए? सबसे इम्पोर्टेंट ये कि हाई रिस्क पेशेंट, जिसकी फैमिली हिस्ट्री कैंसर और प्रोस्टेट है, या जिसकी 2 से ज्यादा रिलेटिव्स में, फर्स्ट डिग्री रिलेटिव्स में अंकल, कजन्स वगैरह को प्रोस्टेट कैंसर, भाइयों को हो चुका है और 65 इयर्स से पहले, उसमें अर्ली स्क्रीनिंग विद पीएसए होनी चाहिए, जैसे 45 इयर्स ऑफ एज पे शुरू हो जानी चाहिए. अदरवाइज जो नॉर्मल पेशेंट्स हैं उसमें अगर इफ यू आर कंसर्न्ड अबाउट कैंसर, 55 to 69 is the age when you should have this test done. Older than 75, it's not recommended because उस वक्त इतना इसका advantage नहीं होता है. So the PSA वैसे age के साथ भी vary करता है. So at 60 to 69, the normal range is up to 4.5, but if it's more than that, then that needs to be investigated. We talked about factors that may affect the PSA level. So once PSA is elevated, we do an MRI of the endorectal MRI that helps to diagnose it. Then you need to do a biopsy, which can be done transperineal and transrectal biopsy. And then we stage the cancer, like अभी जो discussion हुई थी, उसमें MRI करते हैं और bone scan करते हैं, देखते हैं कहाँ तक गया हुआ है, and then we treat it. Depending on what is the stage, we may want to observe the patient, we may want to do surgery, which can be laparoscopic, open, or robotic, or we can do radiation therapy, radiation से जैसे radiotherapy कहते हैं, या फिर hormonal. That will depend on the stage, right? And then we follow this patient up, right? So that is from my side. If there are any questions, we have time. I'm happy to answer.
Does anyone have any questions?
I have a question.
Sure.
What are the precautionary measures which we can take to avoid this prostate cancer?
Okay. So the prostate cancer runs in families. The best thing is to avoid very fatty intake, take a lot of fruits and vegetables, and the diet which is less, जो fats होते हैं, refined fats होते हैं, उसको avoid करना चाहिए. Fruits and vegetables, that is the best thing. इसीलिए देखा गया है कि जो एशियन लोग हैं जो सोयाबीन वगैरह खाते हैं, Chinese and all, they have a very low incidence of prostate cancer, whereas जो नॉर्थ अमेरिकन डाइट जिस तरह से बर्गर्स और ये सारी चीजें हैं, चिप्स हैं, बर्गर्स हैं, इस किस्म की डाइट वहां पे बहुत ज्यादा कॉमन गया है ये. हैविंग सेड दैट, इट रन्स इन फैमिलीज. तो जिनकी फैमिली में प्रोस्टेट कैंसर है उनको अर्ली अपना चेकअप कराना चाहिए, पीएसए का टेस्ट कराना चाहिए. अगर जिसके फादर को अगर प्रोस्टेट कैंसर है तो उनको 45 इयर्स की एज में अपना PSA के टेस्ट करा लेना चाहिए और एक रेक्टल एग्जामिनेशन यूरोलॉजिस्ट से करवाना चाहिए एंड देन मे बी एवरी ईयर और एवरी 2 इयर्स PSA का टेस्ट करना चाहिए कि कोई भी चीज़ अगर होती है तो अर्ली डिटेक्ट हो जाए, वो उनके सारे बच्चों को, एक्चुअली सारे मेल बच्चों को। जी,
Thank you.
Right, Ji. So if there are no other questions, I would like to say thank you, Dr. Saab. This has been a very, very informative session. And thank you for taking the time out to talk to TPL and the employees here. Hopefully, inshallah, we've all learned something new. Even the women in the session, because we all have men in our lives, chahe, you know,
Yeah.
fathers hain, husbands hain. So these are good things to know, and kis tarah se one can be a little more vigilant and hopefully prevent occurrence of any of these. So thank you so much, Dr. Saab, on behalf of everyone. I really, really appreciate your time. Thank you so much.
Thank you very much. Thank you.
Khuda Hafiz, Ji.
Khuda Hafiz.